Hello, this is the video showing you how to do the IV push for a medication that is on a patient where they have an INT. And this is how your setup for your checkoff is going to be. You're going to have your patient chart. You're going to come into your med room here. You're going to look in your patient chart and you have an order that says give Benadryl 25 milligrams IV push now. So the first thing you're going to need to do is from your selection of medications, you're going to need to find your Benadryl. You're going to need to look and see that it's 25 milligrams per milliliter. So I'm going to pull up 1 milliliter of Benadryl. I'm going to wash my hands and I'm going to select a needle that I can pull up my medication in. I'm going to get an alcohol wipe, clean the top. I'm going to put in 1 milliliter of air. Then I'm going to flip over, push that up. I'm going to pull down, I'm going to pull down and push back up to 1 milliliter. Make sure I don't have any air bubbles. Pull that out. I'm going to use the scoop method to put my cap back on my needle because I have to take this to the patient room. Now you're going to be doing all your checks to make sure you have your right patient, your right time, your right route, your right date of birth, no allergies, all of those things. But for the sake of time for this video, I am not doing all those checks, but you will have 3 places you do all the checks. So now I have my medication ready to go to my patient's room. I am going to take my saline flush. I'm going to open it. Again, I'm going to take the top off. If you lay it flat on your surface, you'll be able to recap it pretty easy. You pull down to get it started, and then you push up to get all that air out to start with. So I can recap that now this way. And I am going to my patient's room. Now I have already looked up and know that I can give Benadryl 1 milligram over 1 minute. So I am going to come to my patient's room. And I have her armband I will check. I'm going to put my gloves on now because I am about to access something to my patient. I am taking my alcohol. I'm cleaning this port. And the first thing I have to do is check to see if this IV site's any good or not. I don't know that. So I hook up my flush, and you always pull back and aspirate. You see I got a little blood return, so I know that's good. Now I'm going to push or flush 5 milliliters. While I'm pushing this 5 milliliters, I'm looking to see if there's any swelling, if there's any pain, if there's any leakage or anything going on with the IV site. I don't see anything, so I've got my 5 milliliter flush in. I've got my medication now. I take off the needle, clean the site, attach my medication. Now I have 1 milligram of Benadryl that I want to give over 1 minute. So I have to put my watch, and you can only do this if you have on a watch with a second hand. I'm going to get it on, and the first thing I do, I divide that 1 milliliter into fourths. So I will be pushing 0.25 milliliters every 15 seconds, and I am beginning now. And it's hard to push that little bit, so you have to be careful so that you don't accidentally push all of it in one push. So be very gentle, and you do have to practice. And if you have an Apple Watch, your hand keeps disappearing. Okay, I did my second 0.25, so that puts me at the 0.5 mark. I'm still watching my second hand. Okay, now I'm pushing the last 0.25, and I still have 15 seconds that I need to wait. I'm going to take this off, and you put your flush back on, the same flush that you used. You will flush the medication with the same amount of flush as you did medication. So I will flush 1 milliliter every 15 seconds. Now it's really hard to do with this really big syringe, so again, you'll have to practice. So here I go, 0.25, and I wait 15 seconds. And again, for sake of time, I'm not waiting the whole 15 seconds. I do another 0.25. 15 seconds later, another 0.25. 15 seconds later, another 0.25. So I've pushed 1 milliliter over 1 minute. Then I'm going to clamp this tubing, take off my flush, then you check on your patient, then you go document what you have just done.